Members.
Thank you. Next we have item number 4, SB 145. Dr. Pan. Whenever you're ready, Dr. Pan.
Okay, thank you. Thank you, Mr. Chair, members. I present to you SB 145, which further clarifies that a hospital is prohibited from transporting a patient who is deemed medically unstable due to severe intoxication to another location, except when the patient is stabilized or appropriately transferred to another licensed facility. Substantial evidence reveals that Prime Healthcare Services has been transferring patients who are admitted to the emergency room for acute alcohol poisoning to police departments, correction facilities, and county jails by calling 911. Despite being one of the largest hospital chains in the state, Prime has an unusually high number of cases where police are called on patients in their emergency room. For example, in the first 3 months of 2014, 124 emergency calls came from Shasta Regional Center, which is a Prime hospital. This averages 41 calls a month. In comparison, Dignity Health's hospital, Mercy Medical Center, which is only located 2 miles away from Shasta Medical Center, only had 53 emergency calls in the first 9 months of 2014. What has been documented at Prime Hospitals highlights a hole in the current law when it comes to preventing hospitals from dangerously transferring patients. SB 145 is intended to highlight, stop, and prevent this practice that poses a risk to patient safety. I respectfully ask for an aye vote, and I have witnesses in support.
Witnesses in support.
Good afternoon. My name is Benigno Delgado, and I'm Deputy Director of Government Relations of SEIU UHW. I'm here to speak on behalf of our union's 145,000 healthcare workers in support of this bill. I want to thank the committee for the opportunity to speak. SB 145 discourages patient dumping by placing financial penalties on hospitals that have severely intoxicated patients arrested rather than treating them in their emergency rooms. We have found that some hospital systems, and Prime Healthcare in particular, routinely calls 911. In particular, Prime Healthcare has non-combative patients with potentially lethal levels of alcohol in their systems taken to jail. Some Prime facilities call police or 911 more than twice a day seeking to have patients taken into custody. For example, one Prime facility, Desert Valley Hospital in Victorville, California, called police or 911 an average of 726 times a year from 2010 through 2014, a total of 3,326 calls during that period. Prime Shasta Region Medical Center almost 7 times the number of calls to police and 911 than a nearby hospital or comparable size owed by a different hospital operator. The state has a compelling interest in stopping this practice before it can spread. The patients who this bill protects are medically unstable and are put in peril when transferred to police custody. Currently, patients with blood alcohol levels higher than 0.4, a level of which the patient can die from alcohol poisoning, are being put in police cruisers and dumped onto the criminal justice system. This legislation will ensure that all patients are stabilized before being discharged. Then the criminal justice system is not relied on as a way to get rid of undesirable patients. Current law failed to prevent Prime from endangering patients in this fashion, and by extension, would fail to prevent a similarly profit-obsessed hospital in the future. Thank you.
Good afternoon, Mr. Chair and members. Pat Whalen, Ellison Wilson Advocacy here on behalf of United Nurses Association, Union of Healthcare Professionals, a proud member of AFSCME. We support SB 145 because it eliminates an ambiguity in current law. No less an authority than the American Medical Association, in their Journal of Ethics, did a study on patient dumping and found that even though federal law EMTALA has been on the books since 1986, and even though 43 states have laws that mirror and supplement EMTALA, still over a 4-year period, 527 hospitals had violations, largely due to ambiguity. What SB 145 does is make clear that severe alcohol intoxication is a medical condition that deserves treatment that all the other rules apply to. So we urge your support.
Additional witnesses in support?
Good afternoon, Chair and members. Michelle Cabrera with SEIU State Council in support.
Witnesses in opposition?
Good afternoon, Mr. Chair and members. Connie Delgado with the California Hospital Association here in opposition. And our opposition is really quite simple. The provisions of this bill already exist in current law, under state and federal law, and there are already appropriate provisions for penalties to be placed on hospitals. So for these reasons, and I will actually mention that we have also asked to see some of the evidence that was mentioned in opposition or in support of this bill against one of our hospital systems. And we have asked for that information, have not received it. If violations to the level that they are mentioning did occur, CDPH has the complete authority to go in and levy penalties. And so for these reasons, we feel this bill is unnecessary and are here in opposition.
Thank you. Additional witnesses in opposition? Seeing none, any questions or comments from members? Can entertain a motion? We have a motion. We have a second. Dr. Pan, would you like to close?
I respectfully ask for an aye vote. Thank you.
Thank you, Dr. Pan. We have a motion. We have a second. The motion is due pass to Judiciary Committee. Madam Secretary, please call the roll.
Bonta?
Aye.
Bonta, aye. Mainshine? Bonilla? Bonilla, aye. Burke? Burke, aye. Chavez? Chu? Chu, aye. Gomez? Gonzalez? Hernandez? Lackey? No. Lackey, no. Nazarian? Patterson? No. Patterson, no. Ridley Thomas? Rodriguez? Aye. Rodriguez, aye. Santiago? Steinnorth? No. Steinnorth, no. Thurmond? Aye. Thurmond, aye. Waldron? Wood? Aye. Wood, aye. 7. Yes, 3.
The vote is currently at 7-3. You need 3 more votes.
Thank you.
Thank you. We'll leave that on call. Thank you, Dr. Pan. Next, we have item number 6, SB 361, Senator Hill.
Thank you, Mr. Chair and members. The CDC estimates that at least 2 million Americans are infected with and at least 23,000 die from antibiotic-resistant infections each year. There are multiple causes of antibiotic resistance, the overuse and misuse of antibiotics being one of the most prominent. Nationwide, up to 70% of nursing home residents receive an antibiotic every year, and studies suggest that 25% to 75% of antibiotic use in long-term care settings may be incorrect. According to the CDC, each year 27,000 nursing home residents acquire antibiotic-resistant infections. SB 361 helps reduce inappropriate antibiotic use in nursing homes by requiring them to establish antibiotic stewardship programs, which are a commitment to use antibiotics only when necessary, to choose the right antibiotics, and to administer them in the correct way. Effective antibiotic stewardship helps preserve the life-saving potential of these drugs for the future. Thank you. And I respectfully ask for an aye vote, members.
Thank you, Senator. Witnesses in support?
Good afternoon, Mr. Chair. Luis Sanchez on behalf of Blue Shield of California in support.
Kat DeBerg with the Health Officers Association of California in support.
Thank you. Thank you. Witnesses in opposition? Seeing none, we have a motion and we have a second. Questions or comments from committee members? Seeing none, Senator Hill, would you like to close?
I have closed. Thank you. Respectfully ask for an aye vote, members. Thank you. Thank you.
Thank you. We have a motion. We have a second. The motion is due pass to appropriations. Madam Secretary, please call the roll.
Bonta?
Aye.
Bonta, aye. Mainshine? Bonilla? Burke? Aye. Burke, aye. Chavez? Chu? Chu, aye. Gomez? Gonzalez? Hernandez? Lackey? Aye. Lackey, aye. Nazarian? Patterson? Patterson, aye. Ridley Thomas? Rodriguez? Rodriguez, aye. Santiago? Steinnorth? Steinnorth, aye. Thurmond? Thurmond, aye. Waldron? Wood?
Thank you very much.
Wood, aye.
Thank
9-0. Needs one more.
The vote tally is currently 9-0. You need one more. We'll leave that bill on call for other members to vote on it upon their return.
Thank you, Mr. Chair. Thank you very much, members. Appreciate it.
Thank you, Senator Hill. We have one more bill left. My understanding is that the author, Senator Morrell, is currently presenting in Higher Education Committee. So we are going to patiently wait for our colleague to get to Health Committee to present. In the meantime, we'll take up the consent calendar. We can entertain a motion on the consent calendar. We have a motion and a second. We have a motion and a second on the consent calendar. Madam Secretary, please call the roll.
Bonta?
Aye.
Bonta, aye. Mainshine? Bonilla? Burke? Aye. Burke, aye. Chavez? Chu? Chu, aye. Gomez? Gonzalez? Hernandez? Lackey? Lackey, aye. Nazarian? Patterson? Patterson, aye. Ridley Thomas? Rodriguez? Rodriguez, aye. Santiago? Steinnorth? Steinnorth, aye. Thurmond? Thurmond, aye. Waldron? Wood? Wood, aye. 9 needs one more.
The vote tally in the consent calendar is currently 9-0. We will leave that on call for additional votes when members return. For committee members and staff of committee members who are following along, we are almost at the end of our Health Committee hearing, so I encourage you to come down to the hearing room to cast your votes. Senator Morrell, our last presenting author, is on his way and will be here shortly. Good afternoon, Senator Morrell.
I apologize being late. I was in another committee and submitting the bill, and they just took a while, so thank you.
No need for the apology. We understand. We have you for item number 7, SB 407. Whenever you're ready.
I'm ready.
Please
thank
present.
you, Mr. Chair.
Thank you.
Thank you, committee members. SB 407 adds licensed midwives to the list of providers eligible to participate in the comprehensive prenatal services program under Medi-Cal. Licensed midwives provide comprehensive childbirth, prenatal health, and other education to their patients. Studies have shown that women who receive these services have healthier pregnancies and less complicated births. Under current law, however, licensed midwives are not recognized as eligible providers of these benefits, which fall squarely within their scope of practice. So SB 407 expands health care access to low-income mothers and gives them a choice. Expectant mothers of all income levels should have options when it comes to deciding where and how they bring their children into the world. So SB 407 specifically clarifies that it will not expand the scope of practice of licensed midwives. The bill simply allows the midwives to provide the services to Medi-Cal recipients that are covered by the Comprehensive Prenatal Services Program, and that they are already authorized to provide to the general public. With me today to testify in support is Sarah Davis with the California Association of Midwives and Jasmine Gordon with the California Black Health Network. Thank you very much.
Thank you. Witnesses in support.
Sarah Davis, California Association of Midwives. Chair and members of the committee, thank you for your consideration of SB 407. SB 407 will help meet the demand for Medi-Cal services for pregnant women, expand prenatal care options for families desiring licensed midwife services, and improve pregnancy and newborn health outcomes while controlling costs. Comprehensive perinatal services providers under this program provide both standard prenatal care and coordinate enhanced services. Coordination of services under the program means assessing the patient's health education status, nutritional status, and psychosocial status, and then making referrals to other healthcare providers as needed. This type of individualized, holistic assessment and planning is a hallmark of licensed midwife practice and is within the current scope of practice of licensed midwives in California. The care a woman and family receive during pregnancy creates a long-lasting impact on their health and well-being. Increasingly, consumers are choosing midwives for their prenatal care because they realize the positive long-term impact from the care. Licensed midwife care is cost-effective and patient satisfaction rates are extremely high. However, nearly half of women in California use Medi-Cal services during pregnancy, and therefore, under existing law, are denied access to the option of comprehensive perinatal services with a licensed midwife during their pregnancies. Licensed midwife care shows reduced rates of preterm births, reduced rates of cesarean birth, and increased rates of breastfeeding. All families deserve access to this care if they desire it. Licensed midwives can also fill the gap of CPSP providers in medically underserved areas, as well as increase the number of CPSP providers of color, thus increasing the geographic and cultural accessibility of prenatal care to California's most medically vulnerable pregnant mothers. Thank you for your consideration. We respectfully ask for your aye vote.
Good afternoon. My name is Jasmine Gordon. I'm a policy analyst with the California Black Health Network. SB 407 is very important to our organization because of the devastating infant mortality rates in the African American community. Black infants are 2.5 times more likely to die in infancy compared to non-Hispanic white infants. 1 in 7 births to African American mothers was preterm, and the preterm birth rate is 1.5 times the rate among white mothers. The disparity is largely related to the greater incidence among black infants of prematurity and low birth rate, congenital malformations, sudden infant death syndrome, and unintentional injuries. The greater incidence, in turn, is related to a complex interaction of behavioral, social, political, genetic, medical, and healthcare access factors. Thus, to influence the persistent racial disparity in infant mortality, a highly integrated approach is needed, and we believe that SB 407 is the first step. Studies show that women who receive the various services offered by midwives during pregnancy have healthier pregnancies and less complicated births. CBHN believes that midwives will provide essential services to our low-income African American mothers and help to reduce the infant mortality rate of black babies. Thank you, and I ask you for your aye vote.
Additional witnesses in support, please.
Jennifer Haystack from San Leandro. I am a licensed midwife. I'm also a consumer of midwifery, and I'm here representing the nonprofit California Families for Access to Midwives. We represent thousands of families throughout the state who want better access to midwifery care. I support the bill. Thank you.
Thank you.
Amber King with the Association of California Healthcare Districts, also in support.
Thank you. Witnesses in opposition?
Move the bill.
Seeing none. Do we get a second? Oh, witnesses in opposition.
Good afternoon, Mr. Chair. John Valencia, representing the American Congress of Obstetricians and Gynecologists, Chapter 9, California. I'm doing my best Shannon Smith Crowley imitation. She's away on a family medical emergency. We have a position of oppose unless amended. It's a fairly fine point. We have a long collaborative history with licensed midwifery. ACOG, in fact, worked with Ms. Bonilla on 1308 in 2013 to establish licensing and education. It's a fine point. We absolutely concur that licensed midwifery should be within the CPSC as comprehensive providers. We just don't think that they should be the coordinator on the lead basis. We'll continue working with the author and the proponents, but we would respectfully suggest that we're opposed unless amended.
Thank you. Additional witnesses in opposition? Seeing none. Comments and questions from members? Assemblymember Mainshine.
Thank you, Mr. Chairman. Mr. Morrell, I'm in support of the bill today, but one thing that I just would ask as this moves to B&P, that the concerns that were raised by the American Congress of OBGYNs, if you would work on those.
We are in the process, and we are working with them.
Great. Thank you for doing that. I think it raised some good points, so thank you. And I'm pleased to be in support of the bill today.
Assemblymember Thurmond.
Thank you, Mr. Chair, and I want to thank the author for bringing this. We know that a lot of our families use midwives to help make all kinds of family health decisions, and so this is a natural extension of that work, and just want to thank the author for bringing that. And with all due respect to some of the concerns raised today, we understand that midwives help families make really good choices that ultimately result in great health outcomes for our families. Thank you.
Thank you.
Assemblymember Bonilla.
Thank you for bringing the bill. I just wanted to, I'll be staying off, but only because it's coming to B&P, and we're going to be working on it there, and I just want to be able to have that opportunity to approach it without a vote in this committee. Thank you.
Thank you.
Assemblymember Gonzalez.
Thank you. I'm going to be staying off as well. I'm a little concerned. I'm glad it's going. I want to see what happens with, in particular, I'm glad that Assemblywoman Bonilla is the chair of B&P, because I know that her bill 1308 hasn't been fully implemented, and I think how this corresponds to that I'm interested in seeing before I can cast a vote in favor of it, so I'll wait until, or if it gets to the floor. But thank you for bringing it forward.
Thank you.
Additional comments or questions from members? Senator Morrell, can you comment on whether or not there is a scope of practice issue in your bill?
No, I don't believe there is.
Thank you. Do we have a motion in a second? Okay, I think we have a motion. I don't know if we got a second. Okay, we have a second. We have a motion. We have a second. The motion is due pass to B&P committee. Madam Secretary, please call the roll.
Bonta?
Aye.
Bonta, aye. Mainshine? Mainshine, aye. Bonilla? Burke? Burke, aye. Chavez?
Thank you.
Chu? Chu, aye. Gomez? Gonzalez? Gonzalez not voting. Hernandez?
Aye.
Hernandez, aye. Lackey?
Aye.
Lackey, aye. Nazarian? Patterson? Patterson, aye. Ridley Thomas? Rodriguez?
Aye.
Rodriguez, aye. Santiago? Santiago, aye. Steinnorth? Steinnorth, aye. Thurmond?
Aye.
Thurmond, aye. Waldron? Waldron, aye. Wood? Wood, aye. And Bonilla was not voting.
The bill passes with a vote of 13-0.
Thank you very much, members. Thank you.
Thank you, Senator Morrell. Okay, that was our last presented bill. We have members who've returned, and we're going to go with the short agenda. We're going to go through each item one by one, starting with item number 1, SB 115, Fuller. Madam Secretary will call the roll for bills that are on call and for add-ons.
Bonilla? Bonilla, aye. Chavez? Gomez? Gonzalez? Gonzalez, aye. Hernandez? Hernandez, aye. Nazarian? Ridley Thomas? Ridley Thomas, aye. Santiago? Santiago, aye. 16-0.
SB 115 is now at 16-0. Item number 2, SB 118, Senator Liu.
Bonilla? Bonilla, aye. Chavez? Gomez? Gonzalez? Gonzalez, aye. Hernandez? Hernandez, aye. Nazarian? Nazarian, aye. Ridley Thomas? Ridley Thomas, aye. Santiago? Santiago, aye. Waldron? Waldron? Not voting.
That was 118, right?
Yes.
Okay.
Patterson, aye to not voting. Okay.
What's 118 now?
16.
16-0?
16-0.
SB 118 is at 16-0. Item number 8, SB.
Consent.
Sure. So we're going to go to the consent calendar. Madam Secretary, please call the roll.
Mainshine? Aye. Mainshine, aye. Bonilla? Bonilla, aye. Chavez? Gomez? Gonzalez? Gonzalez, aye. Hernandez? Hernandez, aye. Nazarian? Nazarian, aye. Ridley Thomas? Ridley Thomas, aye. Santiago? Santiago, aye. Waldron? Waldron, aye. 17-0.
Consent calendar is at 17-0. Next is item number 4, SB 145, Dr. Pan, which is on call.
Mainshine? Mainshine, aye. Chavez? Gomez? Gonzalez? Gonzalez, aye. Hernandez? Hernandez, aye. Lackey? I'm sorry, Lackey's no. Nazarian? Nazarian, aye. Ridley Thomas? Ridley Thomas not voting. Santiago? Santiago, aye. Waldron? Waldron, no. 12-4.
The bill passes 12-4. Next, we'll go to item number 6, SB 361, Senator Hill, which is on call.
Mainshine? Aye. Mainshine, aye. Bonilla? Bonilla, aye. Chavez? Gomez? Gonzalez? Gonzalez, aye. Hernandez? Hernandez, aye. Nazarian? Nazarian, aye. Ridley Thomas? Ridley Thomas, aye. Santiago? Santiago, aye. Waldron? Waldron, aye. 17-0.
The bill passes 17-0. Next is item number 7, SB 407, Senator Morrell.
Chavez? Gomez? Nazarian? Nazarian, aye. Ridley Thomas? Ridley Thomas, aye. It's 15-0.
That bill is at 15-0. Next, item number 8, SB 492, Senator Liu.
Bonilla? Bonilla, aye. Chavez? Gomez? Gonzalez? Gonzalez, aye. Hernandez? Hernandez, aye. Nazarian? Nazarian, aye. Ridley Thomas?
Aye.
Ridley Thomas, aye. Santiago? Santiago, aye.
That's our last one that we called, right? I'll just leave the roll open for 5 more minutes.
16-1.
That bill is at 16-1. I'll leave the roll open for another 5 minutes before we close. If you wish to add on or change your vote, please come forward.
Oh,